Welcome. I wanted to do this video because of the amount of questions I've had about these things recently. And for the anatomy side of it, I have included my tonsillitis video link above. I won't go into that again. So tonsil stones are small hard deposits or calculus that form in the crevices or the crypts of the tonsils. They're composed of debris such as food particles, dead cells and bacteria which become trapped in the tonsils and calcify over time, literally just rotting away. The stones cause symptoms such as bad breath, sore throat, difficulty swallowing, feeling of something stuck in the throat as well. In extreme cases, the pain and swelling is often mistaken for tonsillitis. They're not usually harmful, but can be uncomfortable. They can cause significant discomfort, embarrassment, and recurrent infections. Not nice. Let's have a look at what they're made of so we can understand them a bit better and get rid of them. So, food particles, tiny bits of food get trapped in the tonsil crevices. We've got some dead cells in there, so the shedding of cells from the lining of the mouth and throat can accumulate in the tonsils. Bacteria. Mouth contains a lot of bacteria, good and bad. The bad will proliferate and get trapped in the tonsils. The outcome is not good. We have mucus. The mucus produced in the throat can contribute to the formation of tonsil stones. This is important. I'm going to make a suggestion about your diet to significantly help this. And saliva. Saliva interacts with trapped debris and bacteria, aiding the calcification process. There's nothing you can do about this. It's not really important. Plenty of saliva is essential for keeping the mouth flora healthy, protecting the teeth, lubricating food, and aiding mastication, starting the digestive process, etc., etc. This all results in hard calcified stones. So what actually causes them? Let's have a look. Poor oral hygiene. I think this might be quite obvious. Inadequate brushing and flossing can lead to accumulation of debris and bacteria in the mouth and the throat. Then we have chronic tonsillitis. So repeated inflammation of the tonsils can lead to larger crypts, which are more prone to trapping the debris. Large tonsils, these have more surface area and deeper crypts, with the increased likelihood of debris getting trapped there. Postnasal drip. The excess mucus from the sinuses can drip down the throat and collect in the tonsils. Your diet, certain foods, particularly those that are sticky, small, mucus-forming, can get trapped easily. Dehydration, lack of sufficient saliva flow can reduce the mouth's ability to cleanse itself, leading to debris accumulation. Includes lack of fluids, medication, illness, etc. I realise this contradicts what I said earlier about saliva being a cause, but you really can't win. And smoking. This alters the natural bacterial balance in the mouth and the throat, promoting the formation of tonsil stones and bacteria. Just don't do it. How many people are affected? Are you alone? You're really not. Studies have suggested that up to 10% of the population may suffer from them, so they're very common. There may even be more people affected than this, as some people have them but don't know it, so they've got no pain, no smell, etc. Or they may be just too embarrassed to report it or get help. It's more frequently observed in adults than children. This may be due to anatomical differences and possibility of larger crypt in adults. And it's more common in individuals with chronic tonsillitis or recurrent sore throats as well. How can we prevent them forming in the first place? Some of these are just standard treatments and prevention strategies that I've found on the internet, and I will share my thoughts on them. I have my own special thoughts on things, as you know. Practice good oral hygiene. So brushing your teeth at least twice a day, flossing daily. I would say a water flosser is more effective than dental floss, and your mouthwash is low alcohol free, and this is just to get rid of any trapped food that's there that could end up lodged in your tonsils. Staying well hydrated is important. Drinking plenty of water throughout the day to keep the mouth and throat moist. It prevents debris from getting trapped as well. Also, it maintains good saliva flow, which naturally cleanses the mouth and keeps it fresh. Gargling regularly is important. You could use normal alcohol mouthwash, salt water, or hydrogen peroxide. This decreases the bacterial load and dislodges trapped debris. After meals is most important. Alcohol-free mouthwash is probably the least important of the three. Just use it after brushing your teeth as normal to prevent plaque. I don't really rate it as a very important way to prevent tonsil stones. Salt water gargles. These increase the pH of the mouth, so killing bacteria. Good for preventing plaque and tartar buildup as well, and inflammation if you have inflamed tonsils or mouth ulcers. They also decrease the incidence of upper respiratory tract infections infections, so win-win. Just gargle for 30 seconds before and after every meal, at least twice a day. Hydrogen peroxide. This is a very powerful antiseptic, so not the best for daily use. Only use if things are bad. A few times a week is okay. Aim for a 1% solution. If you purchase stronger, it will need to be diluted. It's good for thinning the mucus in the throat. Don't swallow. A little bit of hydrogen peroxide as well can also be added to the water tank of your water flosser, just to really blast away those areas where there's trapped food. Very good. Now, what I should mention is that using these products, you're getting a general disinfection of your mouth, and that is not good for your good bacteria. You need good bacteria as part of your immune system. So I'm going to show you what you can do about that later on. Avoiding smoking and alcohol is just a no-brainer. So maintaining a healthy diet. What you eat can make these stones worse. So you're aiming for a balanced diet, avoiding sugary foods, which are more likely to get trapped. If you chew raw, crunchy vegetables, this cleanses the teeth and promotes saliva flow, also brilliant for teeth and gum health. Now, in my opinion, mucus-forming foods are a big problem here and can be a massive contributor. So you're talking things like dairy, tomatoes. Have a look online at a list of mucus-forming foods, and if you try and reduce them for a little while, see if that helps, and I bet it will. Now, we want to treat any allergies and post-nasal drip if needed, which can contribute to stone formation. We want to be careful with medicines that can cause dry mouth, such as your first and second generation antihistamines. Regular dental checkups are a must, especially the hygienist, to really clean the teeth and the gums. And water flosser for tonsil irrigation. This is something I've found that people do. I'm not sure if this would be effective, but please be careful if you do this. Put it on the lowest setting, and remember that the tonsils are very sensitive tissue. They could remove trapped debris in the crypts, I suppose. So here's what I would not do. I would strongly advise against this, which I've seen online that people are doing. Putting cotton buds in the mouth to poke them out. Now, the issue with this is you're going to make the crypts bigger. By doing this, you're going to make them bigger. You're going to make the problem worse in the future. So although at that moment in time it seems satisfying, it's going to cause you major issues later on, trust me. Now, that's all general advice, but congratulations if you've made it this far. I'm about to tell you my biggest, possibly life-changing tip. And if all of these strategies so far haven't stopped them forming, we can at least stop them smelling. Here we go. The biggest issue we have so far is too much bad bacteria in the mouth, which causes the smell. If we have more good bacteria in the mouth than bad, they will not smell. They will not cause a smell. So probiotics are healthy bacteria. Most people know them for their effect on the gut microbiome or gut health, but they can help the mouth health too. They target pathogens causing infection, and they stop the increased growth of bad bacteria. Now, you can't just swallow a capsule. They won't work. You need to use a specific product for the mouth, such as mouthwash, lozenges, drinks, mouth rinses, chewable tablets. They'll sit in the mouth and dissolve, and they'll inoculate and colonize the oral microbiome. Some of the benefits include less cavities or gingivitis, peritonitis, oral thrush, no bad breath, reduced respiratory infections, reduced incidence of tonsillitis. There's been reports of reduced oral cancer risk, but I'm not sure about this one. Look up the evidence yourself if you want to. Don't sue me. And a decreased amount of volatile sulfur compounds, which are really smelly. So you're essentially creating a biofilm in your mouth to replace the undesirable bacteria and protect the teeth and the gums. It blocks the bad bacteria from reaching the enamel as well, and the gum tissue. They will leave your mouth feeling really tingly fresh, I promise. You can use them at night to stop the morning breath or through the day. It takes about a week for the biofilm to form, so use for at least 2 to 3 months to assess the effectiveness. But I think it's a game changer. So what if you've tried everything and these things are ruining your life? You just can't get rid of them. You've got no self-confidence. You're sick of them. There are some more serious options that could probably get rid of them, so let's discuss. The first one is laser cryptolysis, and this is using a laser under local anaesthetic. It removes the surface of the tonsils, so eliminating the crypts where the food gets trapped, leaving the surface nice and smooth. There's little downtime, there's less painful, and you still have some tonsillar tissue left. So the tonsils are part of the immune system, so that's a good thing. The only downside is you may need additional treatments. The carbon dioxide laser vaporizes the outer surface. There's less pain, bleeding. It's not always curative. Sometimes you have to get the whole tonsil. It's limited coverage. Now the most permanent option, tonsillectomy. This is surgery performed under general anaesthetic, complete removal of the tonsils. It has a high cure rate, so it's very effective, just a permanent solution. It's invasive. There's a 2 to 3 week recovery, which can be quite grim. The risk of bleeding is quite high and pain afterwards. Obviously, you've got the risks of general anaesthetic there as well, and there's a risk of infection. Let me know in the comments if there's anything in particular that's helped you with this. Let's help each other out and create a nice community.